I'm a non-invasive cardiologist with interests in vascular disease, and I practice at Duke University in Durham, North Carolina. And I've been working in this space for the last 7 to 10 years, although more recently with Vascular Cures, trying to understand a little bit about the patient voice and patient interests, both in terms of engaging in research, but also in terms of what interests patients within vascular disease. What do they feel is unknown? What do they feel is underdeveloped or underaddressed? Trying to understand what patients value so that we can aim our research to understanding things that improve those things. That's the key. And that's where there's no substitute to having a patient and a number of patients involved. It is the patient voice in concert with physicians and with other providers who are going to get these issues raised to the highest level so that we have understanding of the prevalence of this disease, the impact of this disease as far upstream as possible, so we catch disease before it's at the point of saying, you have only one option, it's an amputation. We can partner with Vascular Cures, with other organizations together so that we have the entire group of stakeholders involved. Patients, providers, caregivers, advocates, all have to be involved to be able to move this up the chain in terms of understanding and recognition of the disease, because we've tried everything else to this point and it hasn't worked. The best outcomes seem to occur when both the patient and the physician are invested. And what do I mean by best outcome? Like, what does that actually mean? Well, the best outcome is the one that the patient wants. There's no possible way for me as a physician to know that without engaging the patient and having the patient be engaged. I can guess, but that doesn't always lead to the best outcome. The best outcomes in clinical care are achieved by the patient and provider working together in concert as a team. The same is true in research. And any good team, the team members have to know a little bit about what the other team member does to make it a team that works. And so getting patients from their journey to a place where they're thinking about a clinical study and getting a researcher from their head in the clouds about a clinical study to look at the realities of the journey that the patient is on is key to meeting in the middle and finding the best solution. Where Vascular Cures really can be the keystone is to drive some of these efforts, to bring these groups together that need to be together to do the advocacy, to do the research, to do the outreach so that we can increase the recognition of this disease. Vascular Cures, as a patient advocacy organization that also supports research and supports convening, is primed to be at the pinnacle of doing all of that work.